Hey, good afternoon, everyone. I see that people are still entering the room. Welcome to our virtual education program, the ALZ. My name is Kara Murgatroyd, and I am the team lead for education at the Alzheimer Society. We're excited to be able to connect and learn with you. We're using Zoom for healthcare, which is, of course, I'm sure everyone is familiar with it by now, an online technology that helps us to connect with you securely. If you are experiencing any trouble, send a message to the chat box to the ASNS host, and they'll actually be able to help you with your tech difficulties. Hopefully you won't have any. For today's session, all participants have been muted and their videos have been turned off. With these privacy measures in place, we will be recording the session for future use, so it will go up onto our ASNS, the Alzheimer Society of Nova Scotia YouTube channel. So if you don't have the opportunity to see it today, you can see it later on. As we begin, I'd like to acknowledge that we are gathered on sacred land that has been the site of human activity since time immemorial. We are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq Nation, the past, present, and future caretakers of this land. I also want to recognize and offer gratitude to African Nova Scotians and their ancestors whose histories, legacies, and contributions in 50 communities for over 400 years have enhanced the part of Mi'kma'ki colonial referred to as Nova Scotia. At ASNS, we're working toward becoming a more diverse and inclusive organization. In the next slide, you'll see some of our partners at the Alzheimer Society of Nova Scotia, and it's really important for us to ensure that all Nova Scotians feel a sense of belonging when they use our services, when they reach out for our services at the Alzheimer Society. And so, of course, we use the acronym IDEA to symbolize inclusion, diversity, equity, and accessibility. So we're really applying a person-centered lens to our work and ensuring that we foster a sense of belonging in all of the programming that we do. And of course, some of the partnerships are listed here on the slide. Okay, so I wanted to thank you for joining us this afternoon. Our audience today includes people living with dementia, people caring for somebody with dementia, and then of course people who want to learn more. The presentation today will be about 40 to 45 minutes long, followed by a question and answer session. Please feel free to ask your questions and use the private confidential chat, and those questions are addressed to the ASNS support person, the host. Remember, one of the things to remember though is that we see that question is press enter. So the message gets to us. Questions will only be seen by us at ASNS, and then we will get to those at the very end of the presentation. So today's presentation is Navigating the Path Forward for Dementia in Canada, Results from the Landmark Study. So it's my pleasure today to introduce to you the author of the Landmark Study, and that's Dr. Josh Armstrong. Dr. Josh Armstrong is a research scientist with the Alzheimer Society of Canada and currently lives with his family in Thunder Bay, Ontario. With a multidisciplinary background in the health sciences, Josh brings research expertise in data analytics, gerontology, epidemiology, health measurement, and public health to his work. He completed his PhD at the University of Waterloo in the School of Public Health and Health Systems. After receiving his doctorate, Josh went on to complete an Alzheimer Society research program postdoctoral fellowship with the Geriatric Medicine Research Group at Dalhousie University. Prior to joining the Alzheimer Society of Canada, Josh was an assistant professor in the Department of Health Sciences at Lakehead University. So welcome, Josh.
Thank you, Kara. Happy to be here. Happy to present some of this work that we were doing with the Landmark Study.
Definitely a lot of really important work there.
Thank you. So should I just get started on the presentation?
Yes, please do.
So today I have a number of slides, and I'll try not to go too quickly. I'll be covering some of these results that are coming out of the Landmark Study. So I'll just jump right into it. Happy Valentine's Day, everybody. As hopefully most of you know, that we do expect the number of people living with dementia in Canada to increase fairly rapidly in the upcoming years. We've known this for a long time. You think back to 2010, the Alzheimer Society of Canada produced the Rising Tide report, which kind of highlighted that this issue was occurring. But now the baby boomer cohort, people born after World War II, are starting to get into their late 70s. And over the next 30 years, that cohort of people, it's very large, are all going to get into their late 70s and 80s. And then with age comes a risk of dementia. So with this kind of population change, we're seeing a greater number of people living with dementia in Canada. When we talk about dementia, it's a very much an umbrella term. It covers a range of different conditions. Much of us talk about Alzheimer's dementia, which is commonly referred to as the most common cause of dementia around the world. But we also have types like vascular dementia, frontal temporal dementia, Lewy body dementia. So there's a wide sort of conditions that lead to this condition that we label dementia. One thing to kind of note is that in more recent years, we've come to learn that it's not as easy to categorize people as much as we thought we could. People often have what's known as mixed dementia, number 5 on the list in the table there. Some people have different types of pathologies within their brain leading to some of the challenges that we associate with dementia. And that's actually come to be thought of as maybe the most common form, especially in older adults. When you get into your 80s and 90s, you're often going to have multiple things going on with your brain, and those will have an impact on your cognition in total, not just one at a time. So that's a newer thing. But often too, we think about dementia in older adults, but we are also learning more that young onset dementia that comes on under the age of 65, happens very frequently as well. You might have noticed in my previous slide that I used the term Alzheimer's dementia, which might be new to some people. Often it's referred to as Alzheimer's disease, but there's an important reason why we make this distinction. To begin, like Alzheimer's disease, that term technically is more so the changes that go on within the brain over time. Many of these changes happen many years before any sort of problems occur within the individual's thinking, memory, or mood, or communications. Whereas Alzheimer's dementia is kind of the expression of those changes within the brain. If you look at the figure at the bottom of the slide there, that's the green arrows where you actually see the expression of those brain changes. So it's important to make this distinction because in this report that I'll be talking about today, we're only focusing on the expression of those changes within the brain. So we're focusing on Alzheimer's dementia, whereas we should also mention that Alzheimer's disease, the changes that go on with the brain, happen in lots of people that don't even develop dementia as well. Most people, as they get older, will have some pathology that is associated with Alzheimer's disease, but still may not show any signs or symptoms of dementia. So it's important to kind of make that distinction so we separate the changes that are going on with the brain and the changes that are then expressed, the challenges that we see. Because then we can maybe begin to recognize, like, why do some people not express those changes in the brain? What gives that resiliency to some individuals and not others? And part of that story involves that mixed pathology that I talked about in the previous slide, whereas the more things that are going on with your brain, that's where you start to see the challenges arise. If you just have less challenges within the brain, less issues happen in terms of your thinking and memory, mood, behavior, and communications. A lot of this is described in this great paper by David Bennett, Reducing Your Risk of Alzheimer's Dementia, Building a Better Brain as We Age. He talks about mixed pathologies. He kind of contrasts these two terms and brings up an example of how it's not so much just the Alzheimer's disease pathology that leads to challenges. It's all the different other issues that are also going on within individuals and some of the protective factors too that might help reduce your risk of developing dementia as you get older. We still don't have a full understanding of what leads to the dementia onset in individuals, but we have pinpointed several risk factors that are known to increase the risk that someone might develop dementia. With this list, the primary risk factor is age. The older you get, the higher the risk that you have for developing dementia. But it's important to note that dementia is not a normal part of aging. Many people might have some changes with their cognition as they get older, but only a small percentage of people develop dementia that progresses from mild to severe over a number of years. So there are individuals that can get into their 90s and past 100 and still have normal cognition. So it's not a necessary part of aging. It just is highly associated with aging. There are a number of other risk factors that have been associated with the development of dementia, and they're often divided into two separate groups. The first group on top of this slide is the risk factors that cannot be changed, unmodifiable risk factors. You can't do much about how old you are. You can't do much about what sex you were born. You can't do much about your parents or your genetics. So those things cannot be changed, but other factors can be changed. We can look at education levels. You can look at midlife factors like your heart health, your alcohol intake, obesity, or even look at later life factors like smoking, depression. All these have been associated with increased risk of dementia, and they can be modified or changed if people are given the right resources, the right education. We can hopefully adjust these or adapt these or modify these behaviors in people to make people have better health outcomes. I'll revisit some of these risk factors in some later slides. What we are hoping to do with the landmark study are 5 different things. One, clarify the path forward for dementia in Canada. So kind of give a sense of what to expect over the next 3 decades for the number of people who will develop dementia in Canada. We also want to improve public knowledge of this complex condition or conditions. As I mentioned earlier, that dementia term is an umbrella for many different neurological problems. So hopefully we can provide some insights into the state of the field when it comes to dementia. We also want to use this report to advocate for not only the individuals that develop dementia, but also their families, their care partners, and also the service providers that provide that formal health care to individuals as they go through their dementia journeys. We also hope to create action by researchers, policymakers, physicians, all sorts of people within our society to try to address some of these challenges that we see and optimize the care for individuals who have developed dementia. And the final kind of aim is just to push for change in terms of more dollars for research, change to our healthcare systems. That includes home care, long-term care, hospital care. All these systems need to be kind of changed and adapted if we really want to provide optimal care to people living with dementia. So just a little bit of methods or background about how we created these projections. I'll try not to get too technical here. We worked with the Canadian Centre for Economic Analysis. They're a national organization. They do a lot of work in economic analyses, but what they did was they developed what's called a micro simulation model. So that's combining data from Statistics Canada, census data, so we know everything about all the citizens of Canada. We combine that with risk factors from dementia from the literature, and we can use that to kind of get a sense of what to expect within our population over the next 30 years. So we kind of like a simulation game. You can hit play and see how things change with time. Here we're looking at the Canadian population, accounting for most important facts like age, sex, ethnicity, dementia risk factors, and then we can press play on that model and see what we might expect over 3 decades, accounting for changes in immigration, mortality, and all other sorts of population dynamics. Another cool thing with this type of model is that we can use it to kind of look at if we could delay dementia onset across the population by 1 year, 5 years, or 10 years, how is that going to impact some of these numbers that we're projecting? So we'll get into that in some later slides as well. So from the landmark study, we have 3 reports that we're developing. Today, I'm primarily going to talk about this first report. We released that back in September. You can find it on our website. So it's available. You can go through, you'll see some of the same images that I report here today. That's what we will be talking about. I'm currently working on drafting the next report that is currently called The Many Faces of Dementia in Canada. That will be released out in June, and we'll focus a little bit more on the people who will be developing dementia in the next 30 years. Closer look at Indigenous populations, ethnicities, sex and gender, young onset disease, dementia. And then the final report, likely to come out in 2024, is the economics of dementia. So this first report, producing a lot of the numbers, which I'll share with you today. In the next report, we're going to try to put a face to those numbers And the third report, we'll put dollar figures on top of that and get a sense of what the costs are when it comes to dementia care in Canada and what we expect in the next 30 years. So I'll begin with the first chapter when we cover the current direction of dementia in Canada. Here's just kind of digging into the projection numbers. What do we expect in terms of numbers of people living with dementia in Canada over the next 30 years? And just to give a snapshot of the findings, the estimate for 2020 is just under 600,000 people. By 2050, that number is almost going to triple to over 1.7 million, or 187% change or growth, which is a fairly substantial growth in a short period of time. The estimates for 2023, as of the start of this year, just over 660,000 Canadians live with dementia. And by the end of the year, that number is expected to increase to almost 700,000, with 139,200 new cases or diagnoses happening this year. So the numbers are fairly staggering. What's driving this, as I mentioned earlier, is the aging of the population. We have this large baby boomer cohort, people born from 1946 to 1962, 4. So that cohort of people, that generation, getting into their late 70s currently, in the next 30 years, that's really going to drive up a lot of these numbers. Even though we account for the fact that that generation is living healthier, it's having better brain health outcomes, better healthcare, still, because of the large size of the population, they'll still drive numbers up. Also counted for some evolving immigration patterns. So seeing changes over the number of years, count for that in the model. We can incorporate that and see how some older adults will be coming to Canada and will also be a part of the numbers that we're reporting. We've also tried to capture some changes in the population level risk. So some of our estimates are actually gone down from previous estimates because of, like I mentioned, older adults tend to be healthier today than they were decades ago. I do have to point out, though, that this is not a crystal ball. We don't know exactly what's going to happen in the future. We don't know if risk factor levels will change within the population. We don't know if a new drug will be developed, new treatments, new prevention activities. We don't know how climate change, the stressors that come along with climate change, might impact these numbers. And we don't have any information about COVID-19 infections or the public health response to the pandemic and how those might affect dementia rates moving forward. So we don't know that. All we know is that if we take current trends and we look based on our population, we can get a good guess of what to expect in the next 30 years. So if we follow those trends, we base everything on those current trends. These are some of those results. So the figure on the right, the dark blue bars are what are called prevalent cases, or people living with dementia, that growing steadily over the 3 decades. And the light blue bars within those bars, dark blue bars, are what are called incident cases or new dementia cases. So those are occurring every year. How many new diagnoses do we expect each year? And if to add up all those new diagnoses over this 30-year time period, we estimate that there will be 6.3 million new diagnoses of dementia during that time period. So a large number of Canadians developing dementia. And if we focus in on those blue bars, by the 2040s, every year over 250,000 new diagnoses can be expected, which is equivalent of about 21,000 a month, 700 a day, or 30 every hour. So the numbers definitely increase as that baby boomer cohort gets older. This is the similar numbers, the figure, but we're breaking it down by sex here. So looking at yellow is female and the orange male. And here you can see that females substantially outnumber males across the whole time frame. This comes from the well-known trend or fact that women tend to outnumber males, or females outnumber males at about a ratio of 2 to 1. So about just over 60% of people in Canada living with dementia are females, and this trend is expected to continue over time. Whether this is true or not, we'll see, but this is common across most high-income countries around the world. There are some small populations where we don't see this pattern, but for the most part, this is fairly consistent. I thought I'd just bring some Nova Scotia numbers as well. We also have Nova Scotia data within the model, so we can break things down by province. And here, just contrasting 2020 numbers in blue with 2050 estimates in orange. And you can see a lot of the growth happening in individuals over the age of 75. So the fairly big change here. And you can see a little bit more of a breakdown for a better understanding of how age kind of impacts some of our estimates. The second chapter of the report, we shift focus from the people living with dementia to the care that's provided to those individuals. As hopefully we all know in this Zoom call, it's not an individual journey for someone living with dementia. They not only need the support of healthcare systems, but also of friends or family to help provide some of their daily care. So when we look at people living with dementia in Canada, most people with a diagnosis do tend to live at home. Here I report a couple of statistics from the Canadian Institute for Health Information. So those under the age of 80, almost 70% live at home, and over the age of 80, this percentage drops a little bit, but still the majority do live at home. The challenge is, as dementia progresses, it is a progressive disease, most people cannot optimally manage their lives on their own. They need support, they need help. So in addition to the healthcare system and social care professionals, including also your local Alzheimer Society, most people living with dementia at home will rely on the care and support of what we call care partners. These could be family members, friends, volunteers, neighbors. Often in the literature, in the scientific literature, or you might hear the government talk to them about informal caregivers. We prefer the term care partners. These are unpaid people who provide a lot of care but are not paid by the formal healthcare system. Who exactly are care partners? If we look at the literature, look at the trends, most of the individuals that provide care to people living with dementia are adult children, 58%, followed by spouses of those individuals at just over almost a third, and the remaining 10% could be family, friends, or community members. In essence, care partners are the individuals that provide ongoing care to another person living with dementia who's in need of support. If we look at the role of care partners, the data from the Canadian Institute for Health and Information shows that care partners for people living with dementia provide on average 26 hours each week providing care. This number of hours is related to the severity of dementia, the characteristics of that individual living with dementia, but also the characteristics of the caregiver, and also depending on the extent of changes in mood, personality, behaviors that can occur with dementia. While many care partners find their experiences providing care rewarding, we need to also recognize that it can be very challenging, very stressful, and can have a negative impact on the health and quality of life of that care partner as well. So not only when we're thinking about the upcoming few decades, not only do we need to think about programs and services for people living with dementia, we also need to think about programs and services for care partners who provide a substantial amount of care across the country. And we'll get into the numbers and you'll see why I say that. If you're wondering what are the different types of support that care partners provide, or it's a wide range, it could be anything like assistance with day-to-day core activities, things like shopping, preparing meals, transportation, but it could also be self-care activities like bathing and dressing and grooming, managing support services, managing home care services, also supporting those changes that occur with dementia, changes in mood, personality, and behavior, which also includes things like getting lost, dealing with depression, frustration, anxiety, any sort of repetitive activities, those nighttime or sleep disturbances. So supporting those, and then a whole range of other types of supports as well. The household management, family issues, managing other diseases or other health issues, in addition to the things that they have going on themselves. It's very challenging to try to cover all these, especially as dementia progresses in your loved one. So we take our model and we can calculate the number of people who live with dementia, but then because we're simulating the entire population, we kind of know their families as well. And we can kind of get a rough estimate of the number of people in Canada providing care to these individuals. I would say these are conservative estimate based on the way we can model the data and the estimates that we have in terms of how care is provided. But this is a rough idea of what we are looking at in Canada. So 2020, just around 350,000 individuals. By 2050, that number is again almost tripling to over 1 million, 188% increase over that 30-year time period. And if we were to break down the hours and kind of try to make it into equivalent to a full-time job, in 2020, those numbers equal out to about 235,000 full-time jobs. And by 2050, across Canada, it's about the equivalent of almost 700,000 full-time jobs. So a lot of time and care goes into providing support to individuals living with dementia. And you can see now how that has an influence on, it's obviously it's on the individual level, but if we think about it across the population, it is a lot for our country to handle. We focus in on Nova Scotia. You can see, again, a fairly large increase, not as large as the national average, but still almost doubling over that 30-year time period. Again, these are conservative estimates. To give you a little bit of insight, we don't have any information about what happens in long-term care. So the model actually assumes that no care is being provided once an individual enters long-term care. And we all know that that's not the truth, but we just don't have the data to kind of support the modeling to look at that in more depth. So again, that's why I say it's a conservative number, because we know that care happens. We also assume it's like a one-to-one basis, one care provider for one person with dementia. And again, we know that's not the truth, but this is we can take the current trends. This is a good way to first estimate what it would look like across the country and by a province. This data isn't really available anywhere else. So this is our kind of a first step to try to better understand what is happening across Canada. So here we took, again, the care partner estimates from 2020 and 2050, but now we're looking at them across age groups. You can see that a lot of the care, at least in 2050, will be occurring by those adult children under the age of 65, potentially directly taking those individuals out of the workforce and having them to take care of one of their loved ones, which can be a challenge for the economy of Nova Scotia, but also we'll see similar impacts across the country. And this is something that we'll dig into a little bit more in our third report, looking at kind of what are the costs associated with people having to leave the workforce in order to provide care. The third chapter is where we get into those models I mentioned, where we can delay the onset of dementia and see how it impacts numbers, to try to get a sense of what is the power of dementia risk reduction at a national level. So when we talk about dementia, it's often described as a challenge that we can't do anything about because it's due to aging and we can't reverse the aging process, but this is entirely false. We've clearly demonstrated that there are actions that can be taken to reduce the risk of dementia. And like I mentioned earlier, some risk factors you can't adjust, like your age, sex, or genetics. There are others that you can, and these are known as modifiable risk factors. So here's a figure from the report that has that same list that I talked about earlier in the presentation, but we've made them a little bit more graphical so you can clearly see some of these issues. Again, organized by the life course. This is what the literature says, where we can best target to try to reduce risk of dementia. But really, all these factors can be addressed at any time across life. This is just what the data shows where the most risk comes from. Here, the numbers come from a Lancet study, which looks at global prevalence of dementia, and looking at these risk factors, their analyses demonstrated that if we are able to eliminate these 12 risk factors, we would actually reduce the number of people living with dementia by 40%. So showing that there's power in trying to address some of these modifiable risk factors. This is just a short list of 12. There are many other factors that are also now understood to reduce dementia risk if we are able to address them. So that list is always growing. Research is always kind of trying to find ways to address dementia. So this is where we might be able to reduce risk and see lower numbers within our Canadian population. Often when we talk about risk factors, we talk about them one at a time, like they're independent of each other, but that's simply not true. Anyone that's worked with older adults knows that older adults don't just experience one issue at a time, one health issue at a time. They often have multiple health issues. And there's a saying too that dementia seldom travels alone. Many health conditions can come up and occur together as people get older. And as scientists, we're just starting to begin to understand how having multiple risk factors will raise the chances of developing dementia on top of just those individual risk factors that are alone. So knowing that the fact that you could have multiple risk factors and that it further increases your risk, this kind of shows that when we're trying to address these risk factors, we should try to address all risk factors exposures across the lifetime, not just focusing on one here, one there. It's all exposures should be minimized. We also have been developing an understanding of this concept of frailty and dementia and how frailty is related to dementia risk. So when we look at frailty, it's a geriatric or gerontology concept, looking at overall health of an individual. And what the research in this field has found is that the frailer an individual is, or the more health deficits that they have, the higher they are at risk for developing dementia. So it's kind of capturing that idea of multiple risk factors using this concept of frailty. So it's important to here, it demonstrates that a person's overall health and frailty level is important to consider when you're looking at dementia risk. This research is really going in interesting ways, and now we're starting to get a better sense of how overall health and frailty might be actually linked to a person's ability to withstand changes in the brain that come with aging. So if you remember earlier, when I talked about how you can have brains that have Alzheimer's disease pathology but don't express, part of it could be because that individual's healthy, active, living an active life, and is able to withstand some of those changes going on with their brain, relative to someone that might be frailer and isn't as resilient to those brain changes that come with aging. So here, just wanted to report some of these findings where we were able to take the model, the simulation model, and push off dementia onset across the population by 1 year, 5 years, and 10 years. And how would that influence some of the numbers that we're seeing? So you can see some of those numbers in the top right there in the table. Pushing it off by just 1 year across the population, we saw a reduction of almost 500,000 diagnoses over that 30-year time period. Pushing it off by 5 years, that number jumps up to almost 2.3 million, and over 4 million for 10 years. 10 years is a fairly ambitious number, but you can see the power that there is in dementia risk reduction. If we are able to delay the onset by those years, we're going to see a huge impact at the population level. The figure on the right there is just looking at the same idea, the 4 different hypothetical scenarios, top one being the current trends, what we kind of estimate within our model. And then with every kind of degree of delay of onset, we see a reduction here in the millions of hours of caregiving that are provided across Canada. It's important to note that while no specific mechanism was identified to do this within the study itself, the goal is to try to understand what would happen if we were able to delay onset by 1 year, 5 years, or 10 years across the population. Here are those same 2 kind of data points, but here from the Nova Scotia side of things. Here, you can see that the reduction that we see if we're able to delay onset by 1 year, 5 years, or 10 years within Nova Scotia. And we're looking at upwards of almost 80,000 individuals avoiding developing dementia if we're able to delay onset by 10 years within the province. Similar concept here. Here we're looking at these 3, or I guess the 4 scenarios, current trends, 1 year, 5 year, and 10-year delays. And the bars represent the change in number of people living with dementia 2020 to 2050. So the current trends, that's where you see almost a doubling within Nova Scotia. If we were to delay onset of 5 years, you can see that we'd almost be in the same place in 2050 that we are in 2020. And then if by 10 years, you can actually see a reduction in numbers. So if we were able to successfully delay onset by 10 years, by 2050, we would see lower numbers than we are seeing today. So reversing that trend, we wouldn't be seeing those increases. Again, really just emphasizing the power of dementia risk reduction. If we were able to successfully do that across our population, we might be able to kind of change those trends so we're not seeing such an increase as we're predicting using the current trends. Again, for the modeling, we didn't include any specific mechanism. So it's just kind of a mathematical simulation that we're doing, but we do know that there are risk factors that we can address to try to reduce these numbers. So here again are those 12 listed. If you think about the Nova Scotia population, what are the risk factors that we see at highest levels in Nova Scotia that maybe we can address to try to reduce risk in the Nova Scotia population? Are there other risk factors maybe that we could also address? That's kind of the way I think we could start thinking about it. We could think about it from the individual perspective. How can an individual address some of those risks? But we can also think about it from a population health or a public health perspective, is looking across the population, how can we begin to start to address some of these challenges? We can also kind of flip the script a little bit too. Instead of focusing on risk factors, we can also think about protective factors. What are things, rather than avoiding negative health conditions, what are positive things that people can do to try to increase their brain health? I also think that using the term brain health rather than dementia risk reduction might be better taken up by younger people across Canada. When we're thinking about brain health and what are some actions that we can take, here from the report, we list 12 actions for a healthy brain at any age. And there are things that you commonly hear across many different conditions of aging, but these also apply to brain health and dementia risk reduction. Things like being physically active, protecting your heart. What's good for your heart is also good for your brain. Staying socially active, managing your medical conditions, challenging your thinking. So not just doing mental leisure activities, but making it so you're actually challenging your thoughts a little bit, learning new things. That's going to help your brain be healthier. Getting good night's sleep, treating depression, reducing your alcohol intake, maintaining your hearing, finding meaning in life, avoid all types of head injury, and adopting healthy behaviors. Taking these kind of approaches are what would be called protective factors, trying to improve your brain health and thereby reducing your risk of developing dementia as you age. The fourth chapter of the report, we're looking at differences across regions of Canada. I'll just be quick with this one. Here, in this map, the bubbles indicate that percentage change from 2020 to 2050. And as you can see, while there's growth across all provinces, doesn't have any data on the territories, but across the 10 provinces, see a large amount of growth. That growth isn't equal across all the provinces based on underlying population structures, current age of the population, of the expected immigration, etc. So here we demonstrate that there is variation in what we expect to see in terms of increases over that 30-year time period. Actually interesting to look into the Nova Scotian data, because we actually see it peak a little bit earlier than 2050. So if we were go to 2045, that number might actually be larger. That's based on the fact that Nova Scotia is already thought of as an older province. So that peak might happens a little bit earlier compared to other provinces. If we were to look across that 30-year time period and add up all the cases or all the diagnoses that would occur over that 30-year time period, and then break them down by province, this is what we would see. And then just based on the large size of the Ontario population, we're looking at almost half of those new diagnoses will be occurring in Ontario. And then as the population is going to get smaller, you see that change across different provinces, with Quebec, British Columbia, and Alberta having the greatest numbers in terms of just raw diagnoses over that 30-year time period. So if we conclude the report with this fifth chapter, finding the best path forward, where we kind of summarize the findings and then kind of make a series of recommendations for how we might address some of these challenges. And we kind of highlight the fact that all people in Canada have a role to play in this challenge, whether it's an individual all the way up to the federal government. Everyone can play a role to try to address what we will see over the next 30 years. So to sum up what I've told you today, dementia will be a growing health growing public health challenge in the next 30 years, with a large number of people developing dementia, and that number is almost tripling the current level. With the current trends that we're seeing now, 1.7 million Canadians could be living with dementia by 2050, with over 6.3 million new diagnoses during that time period. The caregiving requirements that will need to be met by families, relatives, and friends will be challenging, and there is a lot of potential power for dementia risk reduction if we think about those scenarios that we created with the model. So if you look at the report, the recommendations are kind of broken down by different lenses, from individuals to Alzheimer societies to municipal governments, provincial governments, federal governments. Here, I just kind of captured a few of them. And I also note too that I personally don't really expect a cure and effective treatment to happen anytime in the near future, but so we have to take other actions to try to create positive outcomes for people with dementia and their care partners. So that could be things like looking at a national dementia strategy and fully funding it, making sure that they have the funds to work on the activities that they want to address, and also look at corresponding provincial strategies and make sure that they're well funded and can address dementia risk and dementia care within their own provinces. We need to plan for increases in spending for home care, social supports, and long-term care. So we know that these numbers are coming. Are we preparing ourselves for that? Are we preparing our healthcare systems for that? We need to build up assistive interventions designed to assist care partners. We want to help care partners not only manage care for the individuals living with dementia, but also to support the care partners' needs themselves. We should also try to integrate modifiable risk factors for dementia into health promotion strategies. So when we're trying to do health promotion work, make sure that we're trying to integrate some of those risk factors into that work. And also we can work on building dementia-friendly communities, facilities, programs, and services through awareness, training, and design. If we wanted to think about it from an individual's perspective, here are some things you could do. Support care partners within your families and your social networks. Grow and share your awareness about dementia. You can advocate for your community to become dementia-friendly and support those efforts. Advocate for dementia strategies within your own jurisdictions. And also, no matter what your age group, if you're a young person or you're an old person, you can actively improve your brain health and take dementia risk reduction measures by addressing those 12 different activities for brain health that I listed earlier. And you can see here listed on the slide. So the next steps for the landmark study, like I mentioned, I'm currently working on the second report, The Many Faces of Dementia in Canada, and then we expect that to be released in early June of this year. Then we'll follow that up with the economics of dementia care in Canada, but in probably the spring 2024. And here I just give you a little bit of an insight on one of the findings that we'll be covering in the second report. We're kind of break down by ethnicity in these two pie charts, one for 2020 and one for 2050. And you can see the greatest change is in the gray pie. It's the Asian population. So of those with dementia in 2020, only 8% were of Asian descent. By 2050, we expect that number to increase to 24%. So by 2050, almost 1 in 4 individuals in Canada living with dementia will be of Asian origin. So hopefully we can get in front of these changes in terms of demographics and develop our care systems and our supports to meet the language needs, the cultural needs, and the differences that we see across these different ethnicities. So this is just one of the findings that we'll be covering in the next report. Like I mentioned earlier, we also will be covering sex and gender, young onset dementia, and Indigenous populations and dementia within them. And that's it for me today. Thank you so much for listening. We'll have time for questions and comments and feedback. Feel free to reach out to me if you don't think of it during our discussion period. And thank you so much for your time today.
It's awesome. Thanks so much, Josh. I'm thinking to myself, those recommendations in and of themselves, like looking at the dementia strategy, increasing funding or spending to home care, long-term care, more supports for caregivers, looking at dementia-friendly communities. it goes a long way in trying to, as you said earlier too, looking not at risk reduction, but changing or shifting the way we think about it and looking at it as protective factors, which I think is really key. So looking at those 12 actions for a healthier brain at any age. So it lets people know that, yes, I can do something individually to change, I guess, to change the narrative in and around dementia.
Mhm.
So looking at those protective factors.
So yeah, shifting the focus a little bit about to brain health, because it doesn't
Yeah,
often, if you use the term dementia risk reduction, you're talking to someone in their 40s or below, they're probably not going to worry about it too much, and they think that maybe the dementia is a far off risk that they can worry about when they retire. But we have to kind of, I think so. I think we would sell that better if we talked about brain health. And also, it's important to know that you have to address it when you're in your 20s, 30s, and 40s, because your brain stays with you as you get older. If you're not addressing it during those time periods, you're increasing your risk as you get older.
definitely. And looking at that idea of, like how can we connect with um, early ages? Like I'm thinking in schools, in the school system, how can we change the narrative in and around dementia? And when we think about these 12 actions for a healthier brain at any age, it's really reducing the risk of all of these other disorders as well and illnesses. When you're
Yeah.
looking at staying active and getting enough sleep and mentally challenging yourself and staying socially connected to other individuals, all of those are really, really important in changing, I guess you could, or being protective for those other diseases as well. So I have a few questions that are coming in through the chat, Josh. So the first question is, why is the incidence of dementia in women higher than it is among men?
That's a complex question, but it's primarily driven by the fact that women live longer than men. Right? If you think in Canada, the average age of women are average age of death for women is probably 84 or so. I forgive me if I get these not perfectly correct, but for men it's about 5 years less. So there's just many more years at a higher level of risk. So you see those numbers increase. But that being said, there are many complex differences between men and women that kind of can change dementia risk. So while though it's mostly driven by the age, how women live longer, hormones can play a role, factors throughout the lifetime. So there's gender effects too. So how much education do you receive? What is your occupation during your life? And how much challenging of your brain do you have during that life course? If you're not challenging your brain, there are gender differences in those. So you can see a difference between men and women in terms of occupation, and that can drive things. Exposure to toxins, how risky behaviors, all these things can play a role in dementia risk, and there are known sex and gender differences. So we're trying to dig into that a little bit with this next report.
Okay. And we're waiting for a report too. So that comes out in June of
In
this
June,
year.
yeah, I'm
June of this
currently
year.
working on the
That's
draft.
many faces. Awesome, many faces. Okay. And then the third one is spring 2024, the economics, right?
That's a rough guess. We don't really know exactly. That we just received some of the data for that, so we're checking on that data, and then it's a long process to develop the report. So we'll be doing that as soon as we finish the second report.
Exciting. We'll be waiting. We'll be waiting for that. Um, so as you know, like as you spoke about these protective factors and being able to do to change our health status by looking at those 12 actions. So I have one question here: is it too late for somebody in their 50s or in their 60s or 70s onwards to start using these recommendations that are listed to help lower that risk of dementia?
No, I don't think it's ever too late. Even if you've developed dementia, I think it would be beneficial to improve your brain health. So I think that applies to, yeah, even if you're in your 90s and you have dementia,
Yeah.
you're gonna feel better and have better health outcomes if you take some of these positive actions and work. So it doesn't matter, you're never too old and then you're never too young to start either. If
Yeah.
you look at some of the understanding of like Alzheimer's disease, those pathological changes that happen, often that what is understood is that some of those changes in your brain actually start decades before you see any sort of signs of it. So if you're waiting to see signs, you've almost waited too long. So it's better to start early, but it's never too late to start. It's never too late to work on your brain health.
And I think about the nun study. So when we look at that, and in comparison, I don't want to get into the study, but it's really interesting to see how a person could have, characteristics of the disease, but not express them because of their lifestyle. So it's really kind of interesting. Another question for you. So my mother had dementia. Now I worry at 45, this person is 45, that I may be at risk. And I think you've already presented it. What can I do to reduce the risk? And so it's really looking at those 12 actions that are in the study. So through, as Josh was presenting, Riley added in the chat the link to the landmark study, so that for those of you who want to get a copy of it or would like to read it, read the executive summary or the entire summary, check the link out there. We also have copies at the Alzheimer Society as well that we can mail out to you. I have another question here in the chat. Is there any known correlation between good physical health, not frail, and the progression of dementia in someone living with mixed dementia?
So is there a correlation between someone's health and how they progress? I'm not sure if there's a lot of good research. There's definitely not a lot of good research on the idea of mixed dementias. It's hard to kind of measure that, right? We don't know exactly the pathology someone has within their brain. So it's hard to, because it's hard to measure that, it's kind of hard to study it. But I would guess that the healthier you are, the better your outcome is going to be, the more resilient you might be to some of those changes that are going on with the brain. So if you can have better vasculature within your brain, more blood flow, and you're pumping oxygen through exercise, those are going to be positive things to try to either slow that progression. I don't know if we've seen any evidence of reversing some of those changes. That would be that's the ultimate goal, right? If we are able to find ways to reverse some of those changes, but right now we haven't done that. But if we can, do live healthier lives, more sleep, more physical exercise, healthy eats, all these things that are kind of listed and beyond too. Like we purposely didn't make that list too like prescriptive, because it kind of depends on your personal, where you're at, the resources you have. If you can make positive change, even the slightest positive change, that adds up over time. So I think, well, there's not a good evidence for showing that's the case. I think we can assume that it is.
Great. And another one as well, another question for you. So how do we get this information out to the masses so that they understand that by delaying the onset of dementia, even by 1 year, it can change the trajectory of dementia?
How do we get it out to the masses?
How
I think
how do we do this? And I think you've laid in the report, you've laid out what sort of the health system can do. You've looked also at individuals, how they can take part in this change. From a health systems perspective, what would you recommend? What could you see, or what would be helpful in the broader scheme of things?
Well, I think like if we just, I often think when it comes to health promotion, it boils down to the public health units that do that they provide a lot of the education, the program that looks at health promotion. So if we try to embed some of these ideas of brain health within those efforts, and provide more funding to do that, and think about who you're targeting too. I think you need to be smart at the program and who you're trying to target. This should be probably programming for older adults and also programming for middle-aged adults, and even to try to reach youth as well. More discussion about brain health, how we can improve our brain health, I think is important. So just getting that concept out there and talking about it more, I think can also address this. And I also like the idea of having more research and more discussions around this idea of modifiable risk factors, so people understand that it's not inevitable. It's not like it's just something that happens to you or doesn't happen to you as you get older. There are things you can actively do to adjust your risk. And if you take action, you can reduce that risk, especially if you know might have genetic markers that might raise your risk up a little bit. That if you know, with that knowledge, maybe you want to put extra effort in to try to exercise more regularly, eat healthier food, and get good sleep.
All of those are so important, those protective factors, right?
And not only those are good for like you kind of mentioned, not only those are good for just dementia outcomes, those are going to be good for heart and stroke outcomes, cancer outcomes. So all these conditions that are all directly related to aging would all have positive reductions if we are able to take some of these actions.
And I'm just thinking, like as individuals as well, if you happen to know, if you have a family member that is caring for a person with dementia, it's to be able to be aware that they require that support and maybe reaching out. So individually, how we can support that change and that shift. Yeah, and what we're doing here today too is another part of that. It's learning more. It's that awareness. It's the public awareness of how we can change the trajectory of dementia through systems, individually, like through governments, through health systems, all of these different areas. And I think that's empowering to be able to do that, which is super exciting.
I'm often asked, like, what's the one thing you could do to try to change these trends? And I kind of laugh usually because it's so complex. It's not just one thing.
No, it's not just one
All
thing.
These different healthcare systems, funding pools, we have different levels of government. So it's a very complex challenge that we are faced with. I think we all have a role to play. So learning more and talking about it more, I think that just starts to build momentum, and hopefully before we get to 2030, when we're seeing numbers beyond 1 million, we can try to bring those down through awareness and education.
Super. That's awesome. And as we just wrap up here, Riley's going to add in a poll, possibly. We might have a poll that we're actually going to put in. Maybe not. If you see it, please do it. So just want to thank you again for coming in today and talking about your landmark study. We're super excited to wait for the next report, Many Faces of Dementia, in June, and then looking into the future, 2024, for that second report looking at economics. So while dementia, we know it continues to be a growing issue here in Canada, your study, the study itself demonstrates how delaying the onset of dementia 1 year, 5 year, 10 years, it can have a significant impact on the Canadian population. So it looks at, fewer new cases of dementia, and reducing the number of caregiving hours as well. I was just blown away again. Like, as you read a report, sometimes there's things that pop out and you have to read it the second time, the third time. And then, as you said, when we're looking at unpaid caregiving hours, it's the equivalent of 235,000 full-time jobs. So we can make a mark on that just by being aware and, following the recommendations in the study. We're that much farther ahead to reduce that risk of dementia. So really, really appreciate you coming in and sharing that with us today. Josh, I'll get you to hang out with us for a few minutes. I just wanted to let folks know of some of the things that are coming up with the Alzheimer Society. So coming up on Saturday, April 22nd, we actually have our early stage forum, which is an event that we hold every year. This year, it's actually, so the early stage forum is an education event for people living with dementia and their care partners. This year's theme is Finding Your Path. I wonder where we may have gotten the title, the idea for the title. So Finding Your Path Forward. Again, it'll be Saturday, April 22nd from 10 a.m. till 12 p.m. It's at the Woodlawn Public Library. Don't worry, you don't have to be there in person. You can register and attend in person. However, it's a hybrid event, so you can also attend virtually as well. Look on our website in the next week or so. We'll have more information, but please call us at 1-800-611-6345 if you happen to have questions about, maybe any questions that you have about dementia, any questions about your programs and services, or to get a copy of the landmark study report. We can send that out to you as well. So thank you all once again. We hope you enjoy the rest of your afternoon. Just want to let you know as well that this session was recorded and it will be uploaded to the Alzheimer Society of Nova Scotia YouTube channel so that you can watch it later and share it with your family and friends. So thanks again. And we'll see you in our next ALZ Ed.
Thank you, everyone.
Thank you.